everyone. Welcome to our webinar today, The Wellbeing Potential of Urban Blue Spaces Lessons from the Liverpool City Region. My name is Ellie King, and I'm delighted to be your host for this important discussion. Urban blue spaces such as rivers, lakes, canals, and coastal areas are often considered alongside green spaces in policy, but they offer unique and distinct wellbeing benefits. Today, we'll explore how Liverpool City Region is leveraging its extensive blue spaces to address health inequalities and improve community wellbeing. We'll also consider what lessons can be applied to other urban areas and how policy and planning can better integrate blue spaces into sustainable urban development. We're fortunate enough to have expert speakers with us today. Dr. Charlotte Lyddon and Joanna Hayes from the University of Liverpool will present their research on the role of blue spaces in Liverpool City Region, followed by insights from Vicki Birch, Baatz and James Long from Canal River Trust on the role of waterways in promoting health and sustainability and their experience of using the GroundsWell Community Innovation Fund. After the presentations, we'll open the floor for discussion, so please feel free to share your questions in the chat or you can raise your hand at the end of the presentations. We're excited to have you all here and look forward to a thoughtful and engaging conversation. So let's get started. So Charlotte, if you'd like to take it away for us.
Thanks so much, Ellie. Hi, everyone. I'm just going to share my screen. Okay, hopefully you can see that. Okay, thanks so much. Hi, everyone. My name's Charlotte Lyddon. I'm a lecturer in physical geography at the University of Liverpool. I'm joined by Joanna Hayes in the Heseltine Institute. Joanna will be giving half of this presentation afterwards, so she'll introduce herself when she kicks off. But our presentation to start off with today lies in the fact that we're interested in the Northwest region's blue spaces, how they're represented in planning policy, how they're used by the public, and how wellbeing benefits are derived from them. So we'll be giving a little bit of background on the wellbeing benefits of blue spaces, how we have defined blue space in this research, what we did as part of this research, and then we'll talk a little bit more about how we can realise the wellbeing potential of blue spaces and recommendations for the future. So this project was funded by the University of Liverpool's Policy Support Fund, so it has a sort of policy slant to it. So the term blue space has become common in urban design and public health alongside green space. In green space, vegetation is dominant, but blue space is an environment where water is at the centre of it. We followed the following definition from the Environment Agency, that outdoor environments, either natural or man-made, that prominently feature water and are accessible to humans either proximally, being in, on, or near the water, or distally, being able to see, hear, or otherwise sense the water. So this definition highlights that you don't necessarily have to be in the water, you can be on it or near it to feel the benefits of it. And the health benefits of green space are well established, but evidence for the benefits of blue space is growing and is particularly strong in showing how blue space can benefit mental health and well-being. And evidence of that is shown in our middle column here, with blue space offering the opportunity for restorative experiences and social interaction. However, it remains a real challenge to understand how the breadth of society access and use blue space, with evidence showing those from minoritized communities are less likely to interact with blue space. And there are also well-being risks associated with interacting with blue space, and consideration around safety and water is also required. So these risks from blue space can vary in time. For example, the acceleration of climate change, changes to storminess could pose greater harm to people in, on, or near blue space in the future. So thinking about blue space in the Liverpool City Region, So we've seen that there is evidence that being close to blue space is good for better health and well-being. And we'll show evidence that communities close to blue space are some of the most deprived. So there's both the need and the opportunity for blue space to contribute to improvements to well-being. So here we have a map showing deprivation and blue space in urban areas of the Liverpool City Region. So there are two layers to this map. There is deprivation across the city region, and deprivation is shown across all indices such as health and poverty. But we can also see blue space assets under the coloured map. So we have canals, we have the Mersey estuary, we have rivers. Note there are inland blue spaces as well. So I'd recommend having a look at Natural England's green infrastructure map, if you haven't already done so, to see the extent of how blue infrastructure is defined in more detail. But from this map, some of the most deprived areas shown by the darkest reds are close to the water, blue space, particularly the estuary. This is not the whole of the Liverpool City Region, but this map is just showing the most urban parts. And this map here shows the hotspots of poor mental health in urban areas of the Liverpool City Region. So this data focuses just on mental health. So it shows extreme poor mental health in the city region. The darkest blue areas have a mental health index in the top 1% in England. So there's great potential for people living closest to blue space to gain the most from it. So in respect to the research that we did, last March, first of all, we hosted a workshop in the city centre of Liverpool to bring together practitioners and academics across the region to facilitate discussions between those with an interest in blue space. The 3 questions shown here on the bottom of the slide came out of presentations and roundtable discussions, and we've addressed these in, I suppose, quite a focused area moving forward with the project. So we're interested from the workshop on who uses blue space and how, who is responsible for healthy placemaking, and should blue and green space be treated the same in policy. So overall, this workshop highlighted the interest in blue space across the region, the need for a space or a network to share ideas, and overall it helped to shape the subsequent research. And so we aimed to better understand how blue space is used and valued by people in Liverpool. So in July 2024, we carried out a survey to further explore the wellbeing potential of blue space in Liverpool. We designed a survey and took it out to 2 areas within the city centre, the Marine Lake in New Brighton, shown on the left of the screen here, and then the Otterspool Promenade shown on the right-hand side of the screen here. They're residential areas with one facing the sea, New Brighton or a beach, and one facing an estuary, Otterspool. We describe these as grey-blue spaces. They're blue spaces that are backed by a hard-edged green or grey area. And we picked these 2 areas as being sort of distinct types of blue space. So more of a beach, open coast area at New Brighton, and more of an estuary in Otterspool. And we designed the questionnaire to allow people to tell us why they were in that area and why they chose to spend time in that area. So we spent 1 day at each location last summer on a Friday during the day, intercepting members of the public. We spoke to 138 people across both locations. The gender and ethnicity of those we spoke to reflects that across the city region. We mainly spoke to those in the 55 to 84 age group. Most travelled to the area by car and did so in less than 15 minutes from a postcode nearby. So from this, we can infer that people predominantly use blue space near where they live, valuing quick, convenient access, often achieved via short car journeys. Most people noted they were there for leisure, with being by the water the main reason for their visit. I note that, and we acknowledge the small scale and limited the study to daytimes during the week. So from the discussions that we had with people at both locations, we identified themes in the answers that people gave us about why they chose to visit the area. The first set of these themes are passive benefits gained from being on, in, or near blue space. These could also be described as a connection to oneself and the intrinsic personal value that people place on the area, and can be considered as more emotive. So individuals highlighted that being near the water is relaxing. It provides a space to let go. The sensory qualities of blue space can invoke a sense of well-being, seeing the tides change, seeing the weather change, spotting wildlife, hearing the water is calming. Many people mentioned the idea of fresh air, which could relate to either the feeling of the wind on your face or the air actually smelling fresher and cleaner. But we noticed that people found it quite difficult to actually describe that. The sense of identity and heritage of the city is unique. Those at New Brighton noted how much they enjoy looking across the Mersey to the skyline. The city has capitalised on this in the past, but it may not be something that other councils have connected to. And then more active themes could also be described as a connection to the wider world, why they were there and practical, tangible benefits that they gain. So the locations are destinations that people will travel to so that they can enjoy hobbies or to exercise. Having space alongside the water that is wide, flat, a hard surfaced area to run, walk and cycle on or near the water was highlighted as important for a lot of people, and particularly important for prams, wheelchairs and mobility scooters. One specific example is the value of the marine lake at New Brighton for those to swim in, but also as a place to meet fellow swimmers. So they're important places for runners, friends, swimmers to meet. And this highlights the blue space dual role in promoting physical health and fostering social connections among community members. And finally, many people commented and complimented how well the green space at Otters Pool Promenade that just backs that kind of wide promenade was, and it actually encouraged them to go and use it, enjoy the blue space, and boosted their enjoyment of it overall. So overall, we show that the blue spaces at New Brighton and Otters Pool are well-being assets. And I'm now going to hand over to Jo to explore how they can be utilised better within policy for health and well-being benefits.
Thanks, Charlotte. Hi, everyone. I'm Jo Hayes. I'm from the University of Liverpool's Heseltine Institute for Public Policy Practice and Place. Thanks, Charlotte. So how are wellbeing benefits derived from blue space? Well, we've looked at a conceptual model, and various conceptual models have been proposed to describe the process of linking blue space to wellbeing benefits. But Charlotte, if you could move on to the next slide, this is the one that we have focused on, which is adapted from White et al. They were the authors of a review of evidence of the social benefits of blue space, and this builds on early models of green space and well-being. But in this model, exposure to blue space leads to outcomes of improved human and planetary health and well-being, and it does so by the mechanisms of mitigation, restoration, and instauration. where mitigation is the reduction of negative external influences such as noise or pollution. Restoration is the replenishment of capacity for health and well-being, for example, by reduction in anxiety. And instauration is the building of capacity for health and well-being. So that might be by physical exercise or by social interaction. And these mechanisms are influenced by modifiers, which may be situational or individual. And interventions, including policy interventions, can act on exposure and modifiers to influence outcomes. So on the next slides, we'll look at some examples of this. Charlotte, if I could, thank you. So exposure to blue space is partly governed by proximity, how close it is to where people are. And in Liverpool City Region, the quantity of blue space is largely fixed, particularly along the coast and estuary. But large capital projects can reduce or increase blue space. So examples might be the Mersey Tidal Power Scheme would likely increase blue space according to our definition. We've got a brand new football stadium on the dock, which actually utilises part of the dock space, so that would reduce the amount of blue space. The draft spatial development strategy in the city region contains policies that might be used to protect or enhance proximity to blue space, and there are some examples there. But blue space and its potential for wellbeing is arguably less recognised in the local plans, although this might change in the review process. Next slide, please. Exposure to blue space is also affected by the extent and ease of access, and coastal access has been boosted in England by the creation of a continuous coastal path. In Liverpool City Region, that is now, as of about a month ago, fully open, although it does currently divert inland around the Liverpool Waters development site, but hopefully that will change in future. And there's an opportunity to link in with other local walking and cycling routes. Other forms of transport are important too, and as Charlotte's already said, I think most of our survey respondents have travelled by car, and many also mentioned the availability of free parking. It's also worth mentioning with regard to exposure that even indirect exposure to blue space, such as through a window, can bring wellbeing benefits. Next slide, please. Situational modifiers in the model are specific qualities of blue spaces that affect wellbeing through modifying those mechanisms of mitigation, restoration and instauration. And the themes that we identified that came through in our survey, we could class those as restorative and instaurative mechanisms. And so the survey responses told us quite a lot about the blue space qualities that people felt made a difference to their enjoyment. Those qualities are likely to be different from place to place. Many different policy areas can impact on those qualities and therefore on the ability of a particular blue space to provide wellbeing benefits. One of the things that came through very strongly from our workshop as well was that we shouldn't only be thinking about capital projects here. Everyday management and maintenance is at least important, but is often under-resourced. Next slide, please. Individual modifiers are people's own characteristics. And the evidence tells us, for example, that young people and people from minoritized ethnic groups are less likely to visit blue space. So policy interventions might seek to improve access for specific groups. And there's work going on in this area, for example, by Natural England and also by GroundsWell. Social prescribing is now established as a way of encouraging people to visit green space for health and wellbeing benefits, but blue social prescribing also exists and has been shown to be both effective and cost efficient. Next slide, please. So it seems that policy is beginning to recognise blue space as distinct from green space, but approaches are somewhat inconsistent. For example, some documents use in green infrastructure as a catch-all term. So it might be defined in a glossary as covering both green and blue space, but then it might be used in a document in such a way as it might seem to exclude certain types of blue space. And we're thinking particularly about the hard-edged blue spaces that we've been looking at. We can see from the model and from our own research that there are multiple ways to influence wellbeing outcomes from blue space. And so a combination of different approaches might be required, and that might mean that competing needs have to be balanced. And just to pick out one example here, we know that there's pressure at the moment to increase housing supply, and in urban areas that might mean building high density. But a repeated theme from our survey was how much people valued the sense of openness that they got from being by the water. So can new waterside development be designed to achieve the required density, but also allow people to be by the water and to feel that openness? Next slide, please. So our conclusions and recommendations. Well, we had some recommendations in terms of how we might work together as partners to realise the wellbeing potential of Liverpool City Region's blue spaces. And we looked at 3 areas: policy, networks and research. Next slide, please. So as part of a health in all policies approach, consider how to maximise wellbeing outcomes from blue space when developing strategies and plans, including the spatial development strategy, which we've already mentioned, but there may be scope for this in a whole range of policy documents. Within those documents, to choose and define terms carefully to ensure they're inclusive of blue space and all types of blue space, including those that aren't blue-green space, but perhaps blue-grey space. To consider how local and city regional blue space collaboration can be enhanced through new and existing forums. And this includes involving local communities and policies and projects for blue space. Wider research has found that there's untapped potential to use urban blue space regeneration as a community-based health intervention. So our study has been small scale and it's just a starting point. And there are many areas that would benefit from further exploration, including barriers for visiting blue space, whether different types of blue space offer different health and wellbeing benefits, how to quantify those benefits, and also wellbeing risks associated with blue space, for example, maybe due to climate change. Next slide, please. So to summarise and in conclusion, Liverpool City Region's extensive blue space can help address its significant health inequalities through its contribution to wellbeing. And the urban coastline in Liverpool City Region is more than its obvious leisure destinations. It can be considered as a series of neighbourhood wellbeing assets, docks, marine lakes, promenades that link to create an opportunity of city regional significance. But realising this opportunity will require a city regional policy framework, and that one that's supported by an understanding of the mechanisms by which blue spaces lead to improved wellbeing and is developed collaboratively with local people. There's one more slide, which is our references, and I think we can circulate this presentation afterwards so that people have access to those. But for now, I will hand back to Ellie.
Thank you there. Yeah, that was a really nice overview and summary of all the research that you've been doing there. We'll come to some questions at the end, but we'll just hand over to the team at Canal River Trust next to give their overview on some of the work that they've been doing on the ground in the blue spaces around the city region.
My name's Anna and I'm the evaluation specialist and I sit in the research and evidence team, Canal River Trust national team. Following me will be Vicki Birch, and Vicki is the participation project manager for health and wellbeing in the Northwest region, and followed by my colleague James Long, who sat next to me, who's the urban engagement manager for the City of Liverpool. So I'm going to start by giving a bit of an overview of the trust and some of the research that we've done actually relating to blue space. So obviously we're the charity who look after approximately 2,000 miles of waterways. Though some of you might be familiar with British Waterways. So British Waterways became Canal River Trust in 2010, 2011, 2012, 2010. In 2012. So we became a charity in 2012. So we are the same as British Waterways, but we now exist as a charity. So here is our overall sort of, it's approximately a theory of change, like a basic theory of change, just to sort of understand. Obviously, there was, when we were British Waterways as a government department, our role was effectively quite, I suppose, functional in that our role was to manage and maintain the waterways. But in that transition to becoming a charity, we've, of course, spent the last 10 years trying to understand what our charitable objective is. So looking at this sort of rough theory of change, we work towards a set of 6 outcome areas that you can see along the bottom. That's all of those ultimately we would see to have a causal relationship with our vision, which is that living waterways that transform places and enrich lives. And I think it's fair to say, just putting it in very simple terms, what we are trying to do is ensure that the canals have a sustainable future. That is our charitable goal as an organisation. So, like I said, 2,000 miles of canals in England and Wales. And alongside those canals, we have calculated that approximately 9 million people live within 1 kilometre of them. Okay, so these are waterways that go through some of the most urban areas, some of the most deprived areas that I'll get to in a minute. But 9 million people live within 15 minutes walk of a Canal and River Trust canal. Of course, there are also other inland waterways and navigable waterways that are not managed by us, but that relates just to the canals that we manage, which is the lion's share of the canals in England and Wales. So it's repeating a little bit what Charlotte showed you, but just bringing it in line with our waterways, which are predominantly canals and navigable rivers. So we've got the IMD heat map again there, but what you can see there is that our canals that run through the Liverpool City region. So you can see just on the IMD heat map, of course, the most red being the most deprived, that our canals run right through them, particularly around the north region of the city. So looking at these stats, so thinking about the 2 most deprived categories of the IMD. So this is a LSOA that's in either the most or the second most deprived areas. So if we take the area of Liverpool in general, of England, that would be 18.1% of the population are in the most deprived category. Then we look at Liverpool City Region, and of course we can see it's higher than average. So 25.8% of people in Liverpool are in either the most deprived or the second most deprived. Then looking at the population that live within 1 kilometre of a canal, that's actually at 25.5%. So evidence that therefore that our canals do run through the most deprived areas. Historically, if you think that canals were a purely industrial asset for the movement of goods, that in some ways historically translates to deprived areas. So these were the areas at the heart of industry that now no longer have their industrial focus and are now ultimately leisure assets. So they're there almost entirely for human leisure and for well-being. So I'm going to just talk you through a study that we did that's similar to the one that you just seen before, but this was a really similar methodology actually to Charlotte and Joanna's study. And this was specifically on the Liverpool Riverside Walkway. So this is the stretch of walkway that runs from the docks all the way down to Otterspool via Brunswick docks. So we, again, similar methodology, we replicated an existing sort of systematic data gathering activity we do called the towpath intercept survey, which is in effect intercepting visitors to the walkway, or it's generally a towpath. Of course, this isn't a towpath. And understanding why they were visiting and their demographics and similar things like that. So as well as intercepting, I think approximately 50% of our overall sample size was a bit more self-selected because we left QR codes and we gave out QR codes so they could access the survey at a later date, but at least 50% of the overall sample size was intercepted. So I'm going to whiz through it because you sort of we found actually quite similar things to what Charlotte and Joanne were talking about. But overall, the snapshot was that this stretch of walkway alongside the Mersey was well liked in general. People pointed out the scenic nature, the natural and heritage features of the environment. Users were much more likely to be using the walkway for a walk in general, as opposed to using it as a functional walk to get somewhere. So we can overall conclude that the pathway is more used as a leisure area and environment, as opposed to a commuting route, for example. So cyclists came up as so this was an overall theme. So multiple respondents, it was a very, very commonly reported theme that cyclists were problematic. So, for example, some wanted better segregation of the cyclists, others wanted better like surfaces and I don't know how to describe it, but like just generally improvements that would make it better for cycling, like surfacing. The majority appeared to be regular and consistent users. The majority lived very close by. I think L1 was it the postcode that was like, there was one postcode that was basically the local postcode that was overwhelmingly higher than other users. So again, similar to the last study, most of them were very local. Elements that detracted were cyclists. So again, cyclists just came up over and over again, and the sort of the issues of sharing the space with pedestrians and cyclists. Also irresponsible dog ownership came up quite frequently. So dogs off lead, dog fouling, and vandalism and litter. And also, again, overwhelmingly the most frequently suggested improvement was to add more greenery. So many people said that they would like there to be, I mean, there was multiple different types of greenery, but for anything from planters to trees, but it was noted that there was very little greenery, although people were still choosing this as a natural space to walk, but people did seem to want more greenery, and also a lot of suggestions to highlight the history and the heritage of the location and its features. So things like there's objects along that walkway that have got a lot of interesting heritage that don't have any signage, for example. So people talked about the need for highlighting more the relevance of these areas. So my last thing I just want to talk to you about, so Ellie asked us about, in our slides, how can we demonstrate the economic value of the use of blue space for wellbeing. So to answer that question, we conducted, so we tend to, most of our sort of evidence of impact to the government, for example, would be economic methodology, predominantly what is set out in the Green Book. So we've conducted over the years quite a lot of economic studies and valuation studies of different components of the waterways. And the year before last, we conducted an aggregation of those studies, all using different types of economic methodology, but just to bring together an overall social value and economic value of the Canal River Trust waterways. So here's just a little snapshot. The report is available online on the Canal River Trust website, those of you who are particularly interested in the breakdown of those valuations. But overall, it was calculated that our annual social value is 4.6 billion, and annual economic value, so that shouldn't be annual, that's our social value, our total social value is 4.6 billion. Our annual economic value is 1.5 billion per annum. So breaking that down into 3 of those 6 areas, if you remember the 6 areas I showed you at the beginning, I've just cherry picked a little bit here based on the topic of this webinar. So we've got health, wellbeing and happiness, for which we looked at physical health in reductions to NHS costs at 1.1 billion, mental health and wellbeing in wellbeing valuation. Also green and blue futures, we valued sustainable transport, such as walking and cycling, and waterborne transport, and we valued renewable energy. And then, of course, an area that's sort of particularly in social research we're interested in doing more on is cultural and environmental assets. So the idea of cultural heritage that we made evaluation for, and then, of course, biodiversity and environmental stewardship. So those are some little snapshots of that aggregated collection of valuations that we've conducted. So that's all from me. I'm going to hand over to Vicki, who's going to talk to you about the Waterside Academy and GroundsWell collaboration project. Vicki, just tell me when you need to change slides.
Thank you, Anna. You can change slides. Thank you. So Anna talked about our waterways of having 9 million people living within 1 kilometre. So we're going to put a spotlight on Sefton for you in this section. So within Sefton in particular, we have just short of 280,000 people living within 1 kilometre. And sorry, no, that's how many people are in Sefton, and there are 44.7% living within 1 kilometre. And as you can see, levels of deprivation within that 1 kilometre reflects those that we see nationally within highly populated areas. Next slide, please. So I'm here to talk to you about a project that we partnered with the GroundsWell team on their Innovation Fund. We were contacted by Waterside Academy, which is a Prue exclusion school that is right on the waterways in Bootle. They had found a gate next to the school, a historical gate, and were interested in developing a paddle sport offer. It had a couple of kayaks donated that were not in very good condition, and they were looking to us for some guidance on what the next steps were. So we applied into the Innovation Fund and saw this as a great opportunity for partnership to really showcase the benefits of what we've seen across our LETS programme, which is our participatory programme, and seeing that young people's well-being was being improved through that programme. But we wanted to shape a sustainable model for the school to do self-led delivery. Next slide, please. So through the project, with there being a waterside location, we were able to establish a hub. That just means that there was equipment stored on site for use by the school. Through the collaboration, we trained 6 of their staff to go through the paddle sport delivery and align into the sport regulating body, which is Paddle UK. So we've also created the relationship, and they're on the pathway to become affiliated with Paddle UK. We also have lots of publicly available tools and resources through our Explorers programme, which targets schools for water safety and STEM. Lots of educational tools that can be embedded into the curriculum. So with the waterside location, the school is keen to do that as well. Next slide, please, Anna. So the project is coming to an end this month, and we're so pleased with everything that has been achieved, and it's far surpassed what we originally hoped for the project. So as we said, there's 6 staff gone through that training, and as the weather's getting a little bit warmer, they will be stepping out. Our project coordinator that has been funded to support that delivery and training is beginning to step away, and the school will begin for self-led delivery. The hub is established, so they have equipment on site and it's ready to use. And so far, 50 students have been engaged in the project, and that's been a collaboration of paddle sport, but then also looking at the wider environment. So really tailoring their education through the art that they're doing to have a fresh view of their local area, and putting things like bug hotels and things like that in the local area. Now, the school itself rebranded recently. It became an academy. So it was originally called Impact Sefton, and it's rebranded to the Waterside Academy, really embracing their canal side location. As you can see in the image there, their students have a new uniform, which is kind of sports themed, which means that they're always ready for physical activity. And through becoming an academy, there is now conversation with the wider academy network that some of their schools will also are interested in taking on some of that training, but will use the waterside location as the main focal point for their outdoor education. Wider than this, the school has partnered with a group called L30 Millions and the L30 Community Centre, and are in conversations about opening up their facilities outside of education times. So during the day, the school will benefit from the equipment, and then in the evenings and during term time, outside of term time, the community partners will benefit from this equipment too. We are also a partner with Sport England on Uniting the Movement, and we're also in conversations with Merseyside Sport about their campaign about creating active schools. So wider conversations that we're currently having with the Sefton Schools Partnership Group is that other schools are expressing an interest in going through the training themselves and then using some of the other hub locations that we have across Sefton. So we'll keep you posted on that as well. Next slide, please. Thank you.
Hi, everyone. Yeah, I'm going to talk a bit more generally about blue spaces and placemaking. drawing on some of the work that Anna mentioned on the Riverside Walkway, but also talk about our wider work in the City Region with a focus on the docks. So the Canal River Trust in Liverpool, we manage the canal, Leeds Liverpool Canal, which runs from west to east out through Liverpool and across the Pennines, and also the Canal Link and South Docks. So some of the challenges we face in managing these areas and improving access for blue spaces, blue infrastructure for people, is around equitable access. So in the urban centre where the docks are, a lot of the immediate housing and accommodation around the water space is it's sort of more affluent communities. It's quite low density. It's not necessarily the communities that are in those experience deprivation that we would be looking to access and engage for our work. Also, historically, if you think about the docks, they weren't built for people to access the water. They were built for trade, for commerce, designed obviously for boats loading and unloading. And we have to work within the context of that historic fabric. So bringing people close to the water, accessing the water, being on the water or near the water, requires us to work sensitively with the historic built environment, which is obviously rightly being preserved. But at the same time, it's how do we adapt those spaces to the use that we want now. Also, because they're historic spaces, there's a challenge of managing them and caring for them and preserving them. So if you increase footfall, you increase usage and visitors, there's an increased demand on the infrastructure that needs to be cared for and maintained. This is the same issue in coastal areas too. If you think about sand dunes and beaches and kind of some of the places around the city region, having people visit those spaces brings with it an impact environmentally, whether that's on the actual the actual fabric of the blue space or the coastal environment, but also in terms of people visiting or arriving at that space, if they're traveling by car, parking, the impact on other local communities. And this is increasingly made problematic by climate change, by the nature of extreme weather events, flooding, extremes of cold. We're generally finding that, particularly on the docks, infrastructure and interventions that we're putting in today that are maybe not built in the same way that people did in the 1840s are more susceptible to damage. We've installed some floating habitats and things in some of the docks, at Liverpool South Docks, and they've been damaged by the kind of the sort of more extreme weather we've had over the past couple of winters. So it's things like that. How do we care for and maintain those spaces is a challenge for us. But in terms of the opportunities for us, we're in a position where the City Council, the City Region Combined Authority and other bodies are looking at planning and master planning for blue spaces, for waterside spaces in the city and the City Region. And that's not just about development in terms of commercial space or increasing housing, which is obviously part of the picture. There is a recognition that this needs to be values-led. It needs to be driven by improving access and equity and making opportunities that the water spaces, the blue spaces in the City Region are there for everybody, not necessarily just the example I gave for the docks, where the people who live immediately close by and maybe people that are not experiencing deprivation in the same way as other parts of the City Region, but that they're accessible and there for everybody. A year or two ago, the Business Improvement District, which is obviously a business group, they produced a document about the waterfront, and their sort of headline for that was ours, yours, and everybody. So again, being inclusive. Something I've noticed too through the work that the local authority, the City Council, have been doing in their preparation for the waterfront master plan or strategy, whatever the final document's titled is. People who've attended some of those engagement sessions have very much been the public as well as kind of other stakeholders, very much a focus on open space and public space, and relates to the point that Anna made about our research on the Riverside Walkway, that people want to see more green space, more space they can spend time next to the water, but also people really keen to be able to get on the water and access the water and do that in a safe and kind of equitable way as well too. There are various projects underway around kind of activity on the water, floating saunas, floating paddle courts, but it's about creating spaces and places that are available for kind of mass access, I think, as well too. The other kind of opportunity is that the scale that some of these development plans work out, if we're talking 10, 20, 30 years, to get things happening, get things moving, there's a potential for sort of more people led, so led by people in those communities or near to those communities, but also meanwhile development too, if there's areas that are even earmarked for development in the medium to long term, if they're adjacent to or by one of our blue spaces, there's an interest and a need for those to be adapted and used in the meanwhile time for somewhere that people can enjoy, and obviously the benefit for people's well-being. Which brings us on to, I guess this is the next step of the research on the Riverside Walkway that Anna elaborated on earlier, is kind of leaning into a vision of our waterfront that's a shared space for everybody, particularly for movement, everyday movement. As we've discussed, people might not necessarily use it as a kind of active travel corridor, but people do use it as part of their everyday experience of outdoor space. So how can we support and encourage that, recognising the uniqueness of the historic assets, so the historic built environment, but also a natural space, an ecosystem, wildlife, things, the experience of nature is a really important part of that space, even if it is the weather. We're looking to develop this work through some partnership work with the council, through their neighbourhood team. As I mentioned, the Business Improvement District, who have got it's unique, I think, compared to any other city in the UK. There's a waterfront business improvement district, so that's a collection of business supporting us, and also work with the healthcare system, the primary care network, and other partners to work with communities to understand. For some communities in the city, particularly the more kind of traditional inner city areas, there are barriers to them accessing our blue spaces for well-being or for other users. So how can we understand what those barriers are and work with those communities to overcome them, to develop community activity that's led and facilitated and kind of guided, but also how can people enjoy and utilise our blue spaces in a self-led, self-directed way to enjoy and explore as part of their everyday movement and physical activity. That's everything. Thank you.
Okay, thanks everyone there for the fantastic presentations. We're going to open the floor for discussion or questions if anyone wants to raise their hand or pop anything into the chat.
I'm kind of curious about something that James, you touched on, and Joanna, you also touched on, kind of like this, all of the planning that's going on. When we think about it, it's going to take a long time. And so what are some of those meanwhile uses? What are some of those things that could happen in the short term to increase access in an equitable way to our blue spaces? And I know, like, sometimes, Joanna, you mentioned, like, it's as simple as like making sure that maintenance is an element that we are kind of stay on top of. But I was just wondering if both of you could speak to that a little bit more in terms of how, like, what is actually feasible in the next couple of years to increase that access.
Yeah, I think you're right. Sort of, there's an element of, and it's the same for, I think, the Canal River Trust across all our sort of blue spaces in the city region, and actually sort of getting the basics right. That's the kind of key thing. So locations are clean, presentable, seating, which is really important for so many reasons. It is really important. It's not always very exciting, but I'm a big fan of wayfinding. Personally and professionally, I think it's really important to, that people know where they're going and how to get there, how long is it going to take them. Things like lighting as well too is really key for personal safety. So there's something about that, about kind of the basics of a cared for and maintained environment. And then in terms of activation, it's about, I guess, in terms of removing barriers, it's creating the invitations. So groups or people or communities who are, close by them, but maybe not accessing the space. It's really about, and our hope and our kind of plan is to, I guess, do the legwork of creating opportunities for those groups to visit, take part in activity. We've been working with a group, an organisation that are based not far from the waterfront, about the opportunity of doing kind of guided, like, experiential bike ride things. Obviously, the waterfront's popular with cyclists, but they tend to be kind of keen, sometimes very keen, almost too keen cyclists, like racing around. So, is there an opportunity to have people who are less confident cycling to get some, upskilled in riding, upskilled in maintaining their bikes, and then their support to take part? So things like that, which are, relatively low cost, quick turnaround to kind of have activity, or you could utilise a meanwhile space for outdoor play or planting or things like that, or just have there's a grass verge you could do your yoga class on, or things like that. So there's a lot of opportunity really for that, I think.
So I can probably also add to that a little bit. The first thing I would say is that in the work that we did, we only talked to people who were actually using blue spaces. So we didn't talk to people who were not using blue spaces. So one thing would be to talk to those people, and I think that's something that Canal and River Trust are involved with. So there's a bit more research to be done around that. A couple of things that come to mind. One is we talked a little bit about blue social prescribing, and the conversation around green social prescribing seems to be quite kind of well developed, but maybe there's less recognition of the opportunities that there might be for health professionals and social prescribers to be utilising blue spaces. I think Charlotte touched on what the high proportion of people that we spoke to who had reached the waterfront by a very short car journey, so a car journey of less than 15 minutes. So there's definitely something about connecting up the waterfront better, both by public transport and active travel. And then the other thing that comes to mind is James and Vicki have touched on perhaps this is a newish thing as well, increased interest in accessing the water, but also the water side for sports. And I know that Sport England are increasingly taking a place-based approach, and Canal and River Trust are doing some work with them. So maybe a wider group of partners could be engaging with how to maybe bring people on the waterfront for sport and exercise.
Vicki, did you want to come in there as well?
I think Kate was before me, but it was just to pick up on the point that Joanna's just said. So historically, around the 80s, the canals went into disrepair, and it wasn't a very nice place to be. So you typically housing you would see is outward looking, so it doesn't look into the canal and it doesn't back onto the canal. But we had a walk with some of the GroundsWell team just to demonstrate, particularly since the pandemic, we're starting to see a lot more of people taking ownership of the bit of land between their back garden and the canal. And then any new build developments now are starting to be facing the canal, and property prices are generally higher if they are facing the waterways as well. So there is definitely more positive view of looking at the water, being near the water, and living there as well.
Thanks. And Kate, do you want to come in with your question?
Thanks for a great webinar. It's been great. I'm a PhD researcher with GroundsWell looking at disability and social inclusion within urban nature. So there's lots of things coming up which you're mentioning, particularly around transport. If public transport is not accessible, then obviously that this move towards the car-free cities perhaps are causing problems for some people. But moving on from that, I'm looking at sort of the biodiversity element. Obviously, canals and rivers have huge potential for biodiversity as a positive force, and a negative force being barriers perhaps for nature. And I'm just really curious and looking at some of the things you've mentioned, the very sort of choreographed spaces, hard-edged spaces. I'm just wondering what people's thoughts are allowing nature to lead, particularly when we're seeing down in Devon things like beavers, which are back in our spaces now, who sort of maybe manipulate the environment to suit their needs rather than human needs. So I'm just wondering whether anyone's got any thoughts on that.
So in response, I suppose, I think one of the big barriers from our perspective of that sort of philosophy for the waterways is boating. And much as we've got a difficult role really as an organisation, because of course we want to support the biodiversity that the network is responsible for, but then at the same time we also want to support our boating community, for whom the canals are their home, and so therefore we do have a sort of constant battle of managing vegetation that some people hate because it impinges on easy boating, I suppose, and then also supporting particularly like indigenous species of wildlife. So sorry, that's not a particularly good answer, but that's the barrier that we face when it comes to sort of nature leading as an organisation.
I spoke to a few people at Otterspool who were commenting on a recent rewilding of the promenade. So some people were really in favour of seeing a kind of more natural wildflower space that backed the blue space. Other people felt it looked like it had been let loose and was not as aesthetically pleasing. So there's potential for biodiversity in the coastal zone to be boosted with that sort of green backed space, not necessarily the blue space. And some of the blue spaces, especially around the Mersey and the Dee estuary, are kind of they don't necessarily, there are sort of certain environments like salt marshes that are incredibly biodiverse, but there are maybe sort of challenges to make them look nice for people to engage with. So it's maybe a kind of education or kind of highlighting that these spaces are incredibly valuable for biodiversity, for carbon sequestration, for flood hazard mitigation, and maybe a case of signposting to some of those. So there's potential, but I would see maybe the potential really depends on what blue space you're looking at. I suppose there's no single answer on that.
Thank you. And for our last question, I think we'll go to Rob here, please.
Hi, thank you very much for the presentation. My question is really, I suppose, a long-term project. There's a lot of discussion at the moment about a bridge between Otterspool and between Bootle and New Brighton. I just wonder what the views are of the researchers about that project. Thank you.
I think you might be referring to the tidal barrage, the Mersey tidal power project. Yeah, I'm not entirely certain of the location of it, but there's certainly been some discussion, and I know that at the University at Liverpool, some of our kind of more senior partnerships team have been really keen to develop kind of links with the city region to connect in terms of societal environmental impacts of the barrage. My experience has been that the university has extensive kind of expertise that could be lent to understanding what the impacts of it would be. As someone interested in estuaries and working in the geography department, I'm not aware of any direct links that have been created there. Jo, you may be more familiar if there's been anything via the Heseltine.
No, I think those proposals are still at a relatively early stage. In terms of the link to our research, as I understand it, if the barrier did go ahead, there would be a route across it for walking and cycling. So that could be described as a new blue space having been created in the city region by our definition. But that's not a comment on the wider pros and cons of that scheme.
Okay, I think I'll be wrapping it up there, but I'll be sharing the recording of today's session and the slides and the links to the whole registered participants. So thank you again to our fantastic speakers, and thanks everybody for attending and coming to listen today.